Who says nothing in life is free? VETgirl is here to prove that statement wrong. For 14 glorious days, you can have access to all the webinars and resources your heart desires for absolutely nothing, nada, zip. And the best part, you don't even have to enter a credit card. So really, what are you waiting for? Take advantage of this amazing offer and get your learn on. As they say, knowledge is power, and with VETgirl, you'll be unstoppable. Hi, VETgirl here today, and super excited to talk with Dr. Missy Carpentier, who's a board-certified neurologist. And you guys know me. I always love talking to neurologists because I'm a neurology idiot. If it's not T3, L3, or head trauma, I always need the help of a neurologist. So, Dr. Missy, thank you so much for joining us today.
Yeah, of course. Happy to be here. Happy to try to make it somewhat easier for everyone.
Awesome. Well, just so our VETgirl audience knows a little bit more about you, do you mind giving us background about who you are, where you trained, and what you do now?
Yeah, absolutely. So I'm a practicing veterinary neurologist in Minnesota. I've been here for approximately 8 years, and I'm currently in the process of opening up the first neurology-specific practice in the area. So Minnesota Veterinary Neurology will be coming 2025, where we will be solely focused on neurology and rehab, because the two are kind of very, very closely related, and both medical neurology and neurosurgical is kind of my bread and butter. That's what I love to talk about and what I love to do.
Well, you know me, I already have your cell phone on speed dial, which we won't give out in this podcast, but I have one of those breeds that gets IVDD. So
Yes.
Let's start and talk about intervertebral disc disease, or what we'll call IVDD from now on. So I wanted to pick your brain and ask you about it because I know a consensus statement came out a couple of years ago. But first of all, give us a lowdown. Can you go through the 3 types of IVDD for us that we usually see in dogs?
Yeah, for sure. So of course, everyone has, and is probably taught the classic type 1 and type 2. So with type 1 IVDD, this is your classic chondrodystrophic breed. This is your dachshund, your French bulldog, sorry, Justine, and any other kind of long back or low rider breeds. And what happens is discharges generate at a very young age. In a dachshund, it's as young as 2 months of age, unfortunately. And what ends up happening is they get an extrusion, so a massive herniation of disc, versus when you have a type 2, which is usually your large breed, older dogs. This disc has been slowly bulging over time, but it's still encapsulated. So meaning that nice jelly center, your nucleus pulposus, has not basically pushed its way through your annulus. So everything's still intact. You can just kind of think of everything moving dorsally. And when it moves dorsally, what's dorsal is your spinal cord. So these are very commonly kind of like your classic German shepherds. They come in slowly progressive. We don't know that they're that painful because it's been a slow process, and it's not that acute situation when those dogs are really ouchy. And so those are kind of our first 2 classifications, our type 1 and our type 2 that Hansen put together. And then all of a sudden we say, hey, what is this type 3 going on? So type 3 is what we call our acute nucleus pulposus non-compressive, basically extrusion, or there's many different abbreviations for it. A lot of times we'll call it the missile disc, because you can think of it where a ton of bruising to the spinal cord happens. So you have a little tiny piece of nucleus pulposus that shoots up and really bruises or punches that spinal cord. You have a really severe contusion. But the good news with this is that luckily surgery is not needed. So these are cases that are medically managed. As long as the dogs have pain sensation, 80 to 85% of them will do good and will be able to recover. It's a slow process, but they can do really good. And most owners are very happy when they know that it's a type 3 because surgery is not needed.
All right. Well, I know there's a lot we can do when it comes to both medical and surgical management. I'll ask you a couple of questions about that, but I also think a lot of that is preventative, just seeing how prevalent the obesity rate is in some of these breeds. And I wanted to step back and say, first of all, what is a classic signalment? I know you just talked about it, but can you just reiterate classic signalment of some of these breeds that get IVDD, what we can do preventative wise? Like, is it a matter of changing them to a harness? Is it keeping them, on the thin body condition size? Is it feeding them certain foods? Is it putting them on like cartilage protective, glucosamine type products or supplements? So do you mind just talking about signalment, preventative care, and then I would love to chat about medical management once they actually do develop signs.
Yeah. So for your type 1, this is going to be, think of them as your low rider dogs. And usually kind of excluding the Frenchie, because we'll talk about them in 1 second. They're kind of their own individual category. Usually they're going to be your middle-aged to older chondrodystrophic dogs. Okay, so you get your dachshunds, you've got your beagles, you have your corgis, any of those, and they're usually going to be, like I said, middle-aged to older. Versus when you have a French bulldog, they like to present young. And so that we'll talk about them in a little bit because they really are their own separate category. And of course, as the craze of Frenchies has, come out, things have really changed in regards to how we evaluate these dogs. But they can be less than 2 years of age, which is really, really young. We used to never say that if you saw a Frenchie at 1 year of age, it had a disc, it was always going to be something else. But the more they're bred, the more we see them, they absolutely can have discs at that young of age versus a dachshund. It's pretty weird if they have them that young, though they can have them. We just usually don't see it that young. And then your signalment for your type 2, that's usually going to be, like I said, your older large breed dog, slow progression of signs. And then for your type 3, that signalment, it really can be any breed of dog. So it's not necessarily going to be your classic back dog, IVDD dog. It can be anything that they are. And a lot of times it'll be, they were outside running around in the yard and all of a sudden they yelp and they go down. It's a very similar presentation to FCE. And even sometimes when we have these cases, and even when we do MRI, we're questioning, okay, is it that acute non-compressive nucleus pulposus extrusion, or is it that FCE, that fibrocartilaginous emboli? So in regards to what can you do to, prevent this? This is by far the most common question that I get. And besides lifestyle changes, there's really not much that you can do. So in regards to that, with, what I say is if you can try to prevent them, these dogs that are at risk, is from jumping up and down, is going to be the main one, running up and down the stairs. It's really hard to tell somebody that their dog can't do stairs. Like, it's just a natural part of life. But if you can try to train them so that they're not taking, 5 or 6 stairs at a time, that's going to be helpful because it's just a lot of torque on their backs. And if you're doing the jumping, that's the jumping down. That's really, really hard for them. So trying to limit that. I think a harness is always going to be helpful. And one of the biggest questions I get is the obesity factor. And honestly, obesity doesn't play a huge role in regards to if they're going to herniate a disc or not. But it does play a role in regards to their recovery, right? It's going to be a lot easier for a dog to get up and walking sooner, but with both medical or surgical management, if they're at a good body condition score. Versus my heavier dogs, it takes them a lot longer just because they're already not in the best shape and now you're really working them. And so keeping your dog overall, just for general health, of course, at a good body condition score, but also these dogs, because heaven forbid something happens and we do have to do surgery or they are down and what have you, the better body condition score they are, those dogs will just definitely be able, their recovery will be easier. It'll be easier management also for the owners for things like bladder expression. You can actually palpate a bladder in a nice body condition score dog versus some of the Ottomans that we see. So that's the only thing there. So that's what I'll say about that, just overall health. And then when we're looking at, the medical management factor, I think this is also a common question I get. So when is medical management appropriate versus not? And there's so many factors that go into this. If you have a standard back dog and they're still walking, I think medical management is a great option. One of my kind of caveats to that is how painful they are, because I find it so often that if you have a really, really painful dog, they can even be, they're up, they're walking, they're great, but they're so painful. A lot of those cases aren't going to do well with medical management because that disc is just in what I call the wrong spot, whether or not it's up against a nerve or what have you, or just is causing a lot of compression, where some dachshunds, they can only have 20% of their spinal cord left. There's such a huge compression on their spinal cord. They're up and walking and they're just painful. So that's a big component to it. But I always think it's fair to try it in the cases that are walking. Now, in regards to, the cases that are down, I'll always say that, getting a further evaluation with an MRI plus or minus surgery is going to be recommended for those cases. Even if you have a really eager owner in the beginning and the dog's still ambulatory, but is that borderline ambulatory, non-ambulatory, it's never wrong to refer. And what I'll always say is there's, that big kind of stigma out there that, neuro's not going to do anything unless they're down. Like, neuro's not going to do anything unless they're being negative. It's not true at all. There's probably some, people that, yeah, they're not going to do a deep pain negative dog in the middle of the night because staffing is really hard right now. But at the same time, like we'd much rather get them into surgery weak walking because their overall prognosis is going to be better with everything when it all kind of comes down to it. And the other thing with medical management you need to talk to your owners about is the rate of reoccurrence is much higher with medical management, of course, because you're not really fixing the problem. Some of that compression will go away, but the rate of reoccurrence is much higher in regard with medical management. We usually say up to 50% are going to have reoccurrence with that.
Awesome information. Thank you so much. Now, I know it kind of depends on which neurologist you talk to, but like 20 years ago, they were like, you must get Solumedrol immediately. And then depending on where you trained or where did your residency or internship, some would be like pro NSAID versus some were pro steroid versus some were pro nothing for medical management. What do you suggest for the back pain that is a little bit ataxic, has back pain that you see in general practice or in the emergency room?
Yeah, for sure. So definitely, I think if you got 100 neurologists in the room, they'd probably be split down the middle in regards to what each person wants to do. So much of it has to do with your own experience as well as your training. I personally am on the steroid bandwagon. Everybody knows that about me. I think prednisone for all of my back dogs is the way to go. But the reasoning for that is also because if you have a back dog and you have a dog that's presenting just like you said, is a little ataxic and has some back pain, but we're not imaging, well, how do we know it's a disc and not something else, right? It's like, what if it's actually inflammatory disease? So what if that dog actually is meningomyelitis? And that's why they're that way. It happens all the time to us where we see what should be a quote unquote classic back dog and they're actually inflammatory. And then, or there's something like a mass or, something along those lines. If there's something else and we're not going to be imaging to know, I'd rather put them on a medication that potentially can be beneficial for all of those things as opposed to just a disc problem. Now you have some owners too that are just, a lot of them are nervous about steroids and I get it. So it's not wrong to use an NSAID. I just will always let my owners know, like I'm trying to treat for the treatable. If we're not going to go further with things, I'd rather put them on a medication that I know is going to help multiple different potential, differentials that I have as opposed to just IVDD. And then of course, there's always with the medical management and that factor comes, the pain management, which of course is huge. And so I'm a big fan of either gabapentin or pregabalin. I think with a short course of codeine is also very helpful. And I'm not one that uses a lot of methocarbamol. I know a lot of GPs that do. I usually will use kind of my trifecta is pred, codeine, and pregabalin, plus or minus, or gabapentin, either one, depending on what you have. But I know that there are some people that use methocarbamol and they swear by it or not. So I think that's just a personal preference. But I don't have any problem with people using, or GPs using methocarbamol. It's a great medication. It's going to get along with all the other medications. There's no contraindications. I just personally don't use it that much. So that would be the only thing, but it's another great option.
Awesome. All right. So talk to me. And this is also heavily debated, especially if you're in academia, the ivory tower, or you're in private practice, when we cut these dogs. So the question is, when is surgery recommended? And like I've practiced at different places where if it's after midnight, it's going to get cut first thing in the morning. If it's before midnight, what's the general rule or the consensus nowadays when it comes to surgery for IVDD?
Yeah. So I think the main thing is, pain sensation. That's always going to be one of your main factors for those middle of the night dogs. I would say it really, with some recent papers that have come out, has shown that, yes, you want to get to them within 24 hours for sure of them losing pain sensation. But I think that most of us have found that, there's not going to be much difference if you're cutting a dog at 11 o'clock at night versus 7 o'clock in the morning. Me personally, you would much rather have me managing your dog first thing in the morning versus the middle of the night. Like I know I'm more on point at that point. And I think a lot of people are also, kind of on that bandwagon now too. Like, hey, we've already had a long day. Like we want to give them the best chance. Yeah. Now the one kind of caveat to that is the Frenchies. When I was in residency, it just became like, you don't let a down Frenchie, like don't go to sleep with a down Frenchie in your hospital that hasn't been handled. So that's kind of the one where it's very case dependent. But either way, most of those cases, as long as they have pain sensation, can wait until the next day. Now, prior to that, when is surgery correct or not? I do a lot of surgery for dogs that are just painful. So they have minimal neurologic deficits in the neck. That's all pretty much 95% of the reason I do surgery is for refractory pain, for cervical IVDD. And I do a lot of it. For the back too, though, you usually are more likely to have some subtle deficits, but by far, if you have a dog who's super painful and you've treated them with very appropriate medical management, it is never wrong to refer and potentially consider surgery for that dog's overall quality of life. And I'll even have that where, yeah, over the last year, every couple of months, my dog has this bout of back pain. They get better with medications and finally the disc kind of herniates that much more and, oh, they're not getting better this time. So then they come to me and we do surgery. And then, it happens all the time where the owners come in for their 2-week recheck and they feel like they have a completely new dog. They just kind of felt like, oh, my dog was aging. I didn't really notice because it can be sometimes difficult to know. And they're just so thankful. I mean, they feel bad at first until I tell them everybody is duped by their dogs hiding pain, but they feel like they have a completely new dog because they hadn't realized that little bit of pain had been there for so long, really limiting them and what they were willing and wanting to do.
Thank you. That's great information. It's interesting. I always advocate for making that appointment with a neurologist when it comes to IVDD and when it comes to like general seizures, even if you think it's epilepsy, because I think it's so important to have that one-time first relationship, that medical records established, that relationships established. They can always call for follow-up. So again, so important. All right. Last question. You brought it up. Frenchies. So I went to ACVM in 2024 and they had a panel of 3 neurologists. I don't want to say bashing Frenchies, but the presentation was all about all the horrible congenital diseases that they get from, jumping and, having condylar fractures to the majority of backs now presenting as French bulldogs instead of dachshunds. Do you mind just telling me, is it the same IVDD that we see in dachshunds? I know you said it can be more severe. They're a little bit younger. Do they have a poorer prognosis or anything different that we need to warn the owners about?
Yeah, for sure. So what we've found, especially over the years and what has been reported is that, everyone was noticing that, hey, the same stats that we give to dachshunds, it doesn't seem like it's fitting right now for the Frenchies. And one of the reasons being that they are at a higher risk for having epidural hemorrhage. So not only do they have this disc herniation, they also have a lot of bleeding associated with it. And so they have this disc causing compression. And then they basically also have, you can think of it just a blood clot sitting there as well. And so it's not common that they're even just going to be a one-site Frenchie. You're all usually looking at needing to do an extensive hemilaminectomy to not only remove that disc herniation, but also unfortunately to remove all of the hemorrhage. And then you kind of go into it as well. If you think about, we've all seen radiographs of Frenchies and I've never seen a straight spine. And usually if they just have one hemivertebrae, it's pretty impressive, right? And so you think of naturally what those hemivertebrae are even doing to the spinal canal itself. And the spinal canal of a Frenchie is usually just in the TL spine in particular, it's not going to be as big as it should. It's usually going to be more narrow. And so they're starting with a smaller overall surface area for that spinal cord. Then you add disc in there and hemorrhage, and it's just, there's not as much wiggle room there. And the other thing I worry about, with the Frenchies, kind of how I talked to it earlier, is that it's really hard because a lot of these dogs can be young. A lot of them can present at approximately 2 years of age. And so you have these owners that a lot of them are young owners. A lot of them, it's their first time dog and, and they're young, they're babies, they're only 2. And so they say, okay, we've got, their whole world ahead of them. Yes, let's go ahead and let's do surgery, which of course we're all here for. That's, what we want to do, but it's really important to let owners know that the risk of reoccurrence in a Frenchie for a second IVDD is a lot higher. So usually I'm quoting my owners 10 to 20% chance for a risk of reoccurrence throughout their lifetime. It's up to 50% in Frenchies. So I just think it's a lot of information that Frenchie owners need to know. And usually that reoccurrence occurs within the first year that they've already had their first surgery. So, you get them over the first surgery, they're doing great. And then you see them, sometimes it's not even that long. It's 4 to 6 months later and they're down again. And these owners are just torn because they just went through this, and it's how many more times are we going to have to do this, basically? So that's really difficult. And then also in those young dogs too, if they present to you and they're less than 3 years of age, they're at a higher risk of recurrence as well. So not only just because they're a Frenchie, but if they're less than 3 and I'm doing surgery on a Frenchie, I make sure that those owners know that there's a higher chance that I may be seeing them again within the next 12 months. And then they also, unfortunately, have a poorer recovery due to the fact that they have a higher risk of myelomalacia. So myelomalacia is that breakdown of the spinal cord. You can basically think about it as liquefying. And a lot of times we don't know that's going to happen until many days after they lose pain sensation. And so for me, when I get into, I hadn't had the myelomalacia talk. I mean, I would never had it in the beginning of my career. I mean, I did occasionally, but not commonly. Frenchies come and you have it with everyone, even if their dog goes in walking for surgery, you just let them know, because especially if I go into surgery, I mean, some of their spinal cords will be, when I say purple, like dark purple to black. They're not malasic yet, but you know it's going to be coming. And so all of my Frenchie owners go home with, yes, even if we usually talk about if they lose pain sensation, but if I have a spinal cord that's black, I let them know, look, this is where we're at. We still have pain sensation. I don't know, if we're going to have pain sensation for even after surgery or they're discharged and they have it. They're just always on a watch for us for that myelomalacia, unfortunately. And so it's a lot. It's different, right? It's a completely different outlook. And that's why we see a dachshund now and we like jump for joy. Like it's like, you're like, oh, 20-minute Hemi, let's do this. It's great. You're going to be walking the next day. So much fun. With a Frenchie, you still obviously get those good outcomes and they can do very well. There's just on the backside of it where, yeah, they do great for that first day or two. And then all of a sudden the malacia kicks in, or, you're seeing them back 6 months later and the owners are just defeated. And so it's a different story with them than it is with really any other breed.
Really, really appreciate you summarizing this. This is especially important if you work in emergency, right? Because that's what we're seeing. We're seeing the back pain Frenchies or the back pain, anything that's a little bit ataxic. And again, just knowing that they go down quicker, that they have that higher risk of epidural hemorrhage, they have that much higher risk of myelomalacia, of reoccurrence of 50%. It also reiterates the importance of like getting pet insurance as soon as possible, as soon as they get that dog, because remember, once they're diagnosed, they're not going to get coverage on that. So again, that aspect of client communication as soon as they get that dog or, cat is so, so important.
One thing, just because I didn't get to say it, with surgery, just so everybody knows, a dog can be plegic, so completely paralyzed. They have pain sensation. They still have an 85% with surgery that they're going to walk again. If they're DPA negative, we say between 50 to 60%. But I know a lot of times, especially when you come out of vet school, you see your first down dog and they're completely paralyzed and you're like, oh man, we gotta stop. Don't forget to check for that pain sensation because so many of those dogs can do wonderful.
Missy, great information. Totally appreciate it. We see IVDD all the time in the ER and great information. Really appreciate you being on today's VETgirl podcast.
Perfect. Thank you.